In India today, one child loses their life every 4 minutes. Not to hunger or disease, but to the air they breathe.
India is always in the top 10 for bad quality of the air for the citizens.
A new study in 2024 found that long term exposure to toxic air contributed to 1.5 million deaths every year in India. Across the country, PM 2.5 levels are often 10 times higher than what WHO says is safe, making this not a winter crisis but a daily health emergency.
You have a very high mortality associated with the bad quality of the air that the people in India breathe.
For too long, we have treated air pollution as an environmental issue. But in India, it's not just about the environment, it's about health, equity, and survival. In most Indian cities, the crisis of air pollution reminds us that health isn't confined to clinics, it's shaped by how we plan, build, and move. Today I'm speaking with Dr. Maria Neira, former Director of Environment, Climate Change and Health at the World Health Organization, and one of the world's leading voices on linking health, climate, and urban policy. She's helped governments across the globe rethink how cities can move from short term responses to long term resilience and why clean air, well-being, and equity must become part of every urban decision. Dr. Naira, welcome to the Human City podcast. It's such a privilege to have you here.
Thank you very much. It's a privilege for me as well to have the opportunity to talk to you. Thank you.
Thank you. So Dr. Naira, every winter, cities across India, Delhi, Lucknow, Kanpur, disappear into a thick haze. We see headlines every year, millions of premature deaths linked to air pollution. But as a citizen waking up to that air, it really feels helpless. When something is this systematic and feels so far beyond individual control, what can people actually do?
Well, as you rightly said at the beginning of your introduction, health is not starting at hospitals. I've been trained as a medical doctor, and of course, our mission is to treat patients. But even more important is to make sure that our population will not get sick. So how can we promote the health of and provide better conditions? The quality of the air we breathe is fundamental. So using their political power on the vote and putting pressure on their politicians, the local policymakers, mayors or local authorities, those are the ones that can put in place a lot of measures to protect you from the very damaging effects of air pollution.
So you basically what you're trying to say is that it doesn't only have to be an environmental goal, but mainly a basic human right for people.
Well, I think there is so obvious. Try to stop breathing for 1 minute and you will see how vulnerable you feel, how at risk you feel. We need food, we need water, we need clean air. Those are the basic three things. Without these three things, no one can survive. The quality of the air we breathe will have an impact on our health, on all organs of our body in an incredible way. So ask the people who have respiratory difficulties how unpleasant it is when you cannot breathe properly, when you have an asthma. This really generates anxieties. It's devastating not to be able to breathe. So the quality of the air we breathe is absolutely fundamental, human right, fundamental pillar of our health, no doubt.
Right. As I already mentioned that every winter India talks about air pollution, but in the summer we forget about it. From your experience, how do we move from crisis mode to consistent action?
I think, as I say, everything started with a good evaluation of the situation. And I'm afraid that this is not a secret for anyone that when you look at the quality of air in the different countries around the world, I'm afraid India is always in the top 10 for bad quality of the air for the citizens. With certain peaks and acute moments where it's even worse, you have a very high mortality and morbidity, means diseases associated with the bad quality of the air that the people in India breathe. What do we need to do? Well, first of all, saying that there are solutions. We saw other places in the world that were already suffering very high levels of pollution, and now they are going and taking that trend down. So it's possible. And that doesn't mean that their economy went down. I think this is an important factor. We have many examples of cities, countries where the levels of pollution were very high, and they were associating that to the economic development, saying we need to pollute if we want to have an economic development. Well, this is wrong. We can develop economically, and as a public health officer, we don't want to go against the economy and the development of a country, because we know that the economy of a country will have a positive impact on the health of the people as well. But the two things can associate: reducing air pollution while you keep a good GDP and your economy can go up. And we have good examples of economies that went up the moment they started to reduce the level of air pollution, because business and private companies don't want to do business in places where they cannot breathe or where their children will be in hospital 30% of the time because of respiratory conditions. So it's good for business, for the economy, for health, for sustainability. It's good for the future. The benefits are so clear, so obvious. I think we can compare it with access to safe water. Who will disagree with the need to have access to safe water? And we can say the same for access to clean air to breathe. That there is no economy if you have no access to safe water and sanitation.
Nowadays in India, electric vehicles have been sold saying that, this is the next solution for the air pollution. And, in Delhi, it's also said that the pollution is because of the farm fires, because it's happening majorly in winters. So do you think that EV really brings that kind of solution? Because some people say that if we don't have a good public transport system, you're just replacing the cars, the diesel vehicles and petrol vehicles, with the EV vehicles. Is it really a solution? Because this has actually been sold in India.
The solution to solving the problem of air pollution is not only one intervention. Everything started by doing a good assessment of what are the sources of air pollution. And the sources of air pollution are not the same in New Delhi or than in Shanghai or in Mexico City. The sources of air pollution can vary. So the solutions have to be holistic, addressing all of those factors. Countries that are moving into the electric cars, but you need to solve the problem of commuting of the citizens. So the solution is not which type of vehicles. The solution is what can we offer for populations that are socially and economically less privileged and those who can buy an electric car. So you need to have a very good public sustainable transport system. That's fundamental. And this is quite similar in all cities around the world. You need to solve the problem of commuting within the city. So we cannot create something on inequity for our citizens. In Mexico City, at one point, they decided to forbidden certain type of cars, and then very old cars were not allowed to enter into the city. But then you are penalizing those who cannot buy a new car every 2 or 3 years. So you need to have another solution for that. Maybe subsidies for those who have a very old car, or maybe a very good solution for commuting from outside the city and having a navette taking you to the center. Solutions that are not so complicated, but require strategic thinking with different sectors at the local level, city level, urban level. And that's why the role of the mayors is so fundamental on tackling this problem of air pollution. Some mayors of big cities like Paris, Anne Hidalgo, she was even threatened when she took certain measures. So it's not an easy task. But when you look at the different cities that for instance, they close traffic in the center of the city to cars. That was very unpopular at the beginning, and the people doing business, they were complaining. 1 year later, nobody wants to go back to having traffic in those cities. If you have a good mayor or a good governor and decided to do interventions and demonstrate that they are able to reduce air pollution, citizens will vote you for sure. that you need to communicate the benefits. They will see the benefits for the city, but it requires courage, as we did for tobacco. Can you imagine that we were smoking on a plane? Apart from the fact that the damage to your health, the danger that this represents. Today, we cannot go with a lighter on a plane. So we need to do the same with air pollution.
You just mentioned about Anna Hidalgo, and in many of your talks, you've given her example as a strong leadership. I also read about the work she has done. But again, how can developing cities build similar momentum for clean air and health?
I think there are many things that are now irreversible. For instance, for me, one of them is when a group of moms for clean air was created. When mothers and fathers are concerned about the health of their children, that is so powerful. There is nothing better than parents fighting for the health of their children. That is extremely powerful. Those movements are growing, including in India, I understand. And the people are now very much aware that if they have respiratory conditions, it's because air pollution is contributing to that as well. So the moment people knows, that's why it's so important, we need to repeat that every year we have more than 7 million premature deaths in the world associated to the bad quality of the air we breathe. And India, I'm afraid, is on the top of that list in terms of mortality. But it's not only mortality, it's the chronic respiratory conditions, it's the stroke, is cardiovascular diseases, is our brain, is our children. Even before they are born, they are already affected by the bad quality of the air that the moms, the pregnant women are breathing. So we need to keep informing, telling the people that there is a connection, there is a linkage between air pollution and my health. So it's not a question of create a healthy planet or protecting the polar bears or making sure that the glaciers are not melting. No, it's protecting my health. And the moment people understand that, they are gaining now knowledge on that, I think we are going to win, because nothing motivates people more than their health, because without health we are nothing. So the more we link pollution and climate change to our health, the better for advancing of these agendas and creating a healthy environment, because after all, without a healthy environment, we will not be able to survive.
Normally, health and climate are deeply linked, but they are often treated as separate silos because they are handled by different ministries. So, what would a governance model look like where health is embedded in every policy, from housing to transport to energy?
This is the battle in WHO we have been fighting for many years. People used to call health when we have very good hospitals, very good clinics, very good healthcare facilities. This is for when our health fails, and then we need to treat and cure. But health is not that. Health is what we eat, what we breathe, and our behavior. If I live in a polluted area, there is nothing I can do as a citizen to avoid that level of pollution, except maybe not to go out. But this is very unfair. It's my right to be out, to work, to go out to school, or taking my children to school. It's really unfair to submit your citizens to such a bad condition that will be affecting their health. It's very important to remind everyone that they are negotiating with our health. Health professionals tend to be in hospitals, but more and more the voice of the health professionals is infiltrating other sectors. We need to talk to ministers of environment, energy, economy, and reminding them that their decisions, the source of energy that a country will be investing on, will condition our health. I'm always calling mayors small ministers of health or big ministers of health, because their decisions will condition, good or bad, our health. So it's health in all policies, which is this mantra that is fundamental if we want to take care of our health.
You have said before that the biggest injustice is environmental. So, what does environmental justice mean to you in the urban context?
Environmental justice is something that we shouldn't even talk about. We should take it for granted, because it's referred to those environmental conditions that will not create a problem for your health. You are not supposed to be exposed to dangerous chemicals, contaminated water, contaminated air. This depends on policies that the governments and the local municipalities needs to make. Environmental justice means that we should all be able to live in places where our health is not at risk. Because we are polluting, and some countries are polluting more than others, we need to ensure that those communities more at risk will be financially protected and compensated for the destruction that they are creating. There is financial compensation, but there is no way to compensate if you lose your health or you die. Environmental justice is putting in place some legislation that will ensure that it is my right to breathe air that will not kill me. And I'm not saying that it will be as air as perfect as the one that we breathe in the mountains in Switzerland, but at least the air that will not kill me or make me sick.
We measure cities' success or countries' success by GDP. But don't you think that now we should actually measure it by how healthy or livable it is?
I mean, as a public health officer, the answer is definitely yes. For me and for the public health community, saying that the GDP is growing is an indicator, but saying that your population is healthy and they have well-being proves that to do that, you need to have a good GDP. When you use the GDP as an indicator, you can grow in the economy, but maybe you have a percentage of your population in the hospital and you are paying the bill already with your economy. So maybe your GDP could be even bigger and better if you take your population out of the hospital and you keep it healthy instead of keeping them sick. Even for economic reasons, there is a good reason to do that.
But again, when the water is polluted or your land is dry or polluted, people have a lot of issue and the issues are very upfront. Of course, they say air pollution is a silent killer, it's a slow killer. And even though people have issues, somewhere they are used to it. They are like, we'll wear a mask or we might do work from home or something like that. And awareness is there, but the actual behavior change, which is a bigger issue, where health and sustainability become part of how people live, not just what they talk about. So, do you think that it's important to shift towards this behavior change and how to do that?
They say that in public health, changing behaviors is one of the most challenging things we have to do. People don't like to be reminded that your behavior is not good, but doesn't mean that it cannot be done. I was using the example of tobacco, and we changed behavior. It was long process. It was difficult. Some people were saying you are going against my individual freedom, and we changed it with the security belt in the cars, even with the limitation of alcohol consumption if you are driving. Well, here is the same. The behavior is try not to pollute on your own individual space. Try to protect your environment, your house, your neighborhood. There is something we can all do avoiding pollute, because pollution is very bad for health. And then demanding a better public transport system. Get associated with your neighbors and put pressure, present ideas, demand. That's the behavior we need to change. There are even places now saying you have your mobile phone or your watch telling you, oh, this is the polluted area in your city, avoid it. But it's not the solution. This is fake somehow, because you are avoiding the problem but not solving it. So if you want to protect yourself, even if you are rich and wealthy, try to have a city that will not shame you, that will not create those conditions that sooner or later will affect you as well, and try to change the behavior on demanding better quality of the air we breathe. And again, using the health argument, I think, is the most powerful.
One of our listeners is asking that since PM 2.5 is such a deadly pollutant, what is WHO doing with the government of India to ensure stronger real-time monitoring and local mitigation efforts?
Conversations with the government, the ministries of health, WHO prepare the scientific evidence. We have these air quality guidelines telling them what are the standards. We are using those standards to estimate mortality in each country. We are publishing this data. We are telling them how many people is dying because of that. But I think we are doing much more than that. We are providing solutions, demonstrating what are the good interventions that work in other countries. This year, in May, at the World Health Assembly, with the participation of all ministers of health, it was approved a roadmap on air quality and health. There is not legally binding, but all member states of WHO approve it with a very nice consensus. The interventions are there. As I say, those documents are not legally binding. Countries don't like to be ashamed or being on the headlines saying India is one of the most polluted. So we are using that as well, nicely sometimes, but we are using it, saying how can it be possible that China is reducing air pollution and India is not. This kind of healthy competition as well. But if you look at that roadmap, you have the description of the problem, then a lot of solutions and requests to the countries.
And if you were to imagine the city of the future, one that truly lives by WHO's vision for health, of health for all, what would it look like to you?
Well, first of all, let me start with an argument that politicians prefer. It will be a very wealthy, from an economic point of view, city. Because if we put in place a city where you have green areas, where people can go, interact, and relax, and be more protected from the heat, it will be a city where the streets will be less polluted, therefore the health of the citizens will be much better. It will be a city with a very sustainable public transport system. It will be a city with buildings designed in collaboration with the best architects and urban planners for them to design the best ventilation, natural ventilation, energy efficient, materials that will reflect the UV and therefore reduce the temperature and keep the energy. It will be a city where citizens will be happy. We will reduce the bill that we are paying now at the health system, and the economy will go up because you will have a lot of business companies that will be very happy to come to your country.
Thank you so much, Dr. Naira. You remind us that the air we breathe, the streets we cross, and the choices we make, they are all part of our health system. Cities that plan for clean air, green space, and mental well-being aren't just sustainable, they are humane. If you found this conversation meaningful, share it with someone who works on cities, climate, and public health. I'm Ruchita Bansal, and this was the Human City podcast. Thank you so much, Dr. Naira.
Thank you. It was a great pleasure. Thank you very much.